Jason Checkets here with Insurance Professionals of Arizona, where today I'm going to show you how to analyze which Part D prescription drug plan would be the most cost effective for your client who's looking for a standalone prescription drug plan. You're going to do this right on the Medicare.gov site. I recommend you do this for your client. Don't have your client do this themselves because they can go and enroll in the plan without you from this site. So I actually use this tool for my clients. I do the work for them. They actually appreciate that you do this work for them anyway, and then that way you get the commissions. But once you're here on this site, you're going to actually need two things in preparation to be able to do this activity. The first thing is you got to ask your client which pharmacy they prefer to use. That's important. The second thing, obviously, you're going to need a list of the medications that they take. Once you're on the Medicare.gov site, the way you're going to get into this tool is by either clicking on this right here, preview the 2021 health and drug plans. Eventually, though, this button's going to go away. So you can also go up here, sign up / change plans, and go to find health and drug plans. Either way, you're going to get to this next page here where you're going to simply continue without logging in. At this point, you're going to select drug plan Part D. By the way, this process works the same if you're trying to analyze drug costs for Medicare Advantage plans. But for today's purposes, we're going to select drug plan only, and then you're going to enter your client's zip code. Once you have the right zip code put in, you're going to answer this next question. In this case, my client doesn't get any extra help, so I'm going to say I don't get help from these programs, and then I'm going to hit the next button. The whole reason why you're doing this activity is so that you can see the drug costs when you compare plans. So you're going to say, yes, I want to see those drug costs. And then on this next question, I always go to just the retail pharmacy. Mail order typically is going to be cheaper, but when I select retail pharmacy, it gives my client kind of the worst case scenario, right? Obviously, if they save money by using the mail order pharmacy, that's great, but you can mess around with this as you would like. So retail pharmacy, and at this point, I'm just going to start entering in my client's medications. So I have a client, he takes lisinopril. So I start typing it, it's going to start populating down here. Lisinopril, I'm going to add that drug. It's going to ask me which dosage he takes. In this case, he takes a 5 milligram tablet. He takes it 1 per day, which happens to be 30 per month, right? So I'm going to leave it as 30 every month. I'm going to add that to my drug list. So my drug list is starting to add up here. I'm going to add another drug. He also takes levothyroxine. So here's the levothyroxine drug. I'm going to add that drug. And he takes a 75 mcg tablet once a day, or 30 every month. I'm going to add another drug. He happens to take let's see here, chlorothiazide, which is right down here. There we go. I'm not saying these right. Add that drug. And here's a good example of, they have capsules, they have tablets. You got to make sure you know, because typically a capsule might be a higher tier level. So make sure you know for sure whether it's a capsule or a tablet. Okay, once a day, add my drug. If you have more to add, you add it here. If you're done, you hit done. Now, at this point, my client said that he prefers to go to Walgreens. So I'm going to put Walgreens here in my search. I'm going to find that pharmacy. Scroll down here, you'll start seeing the Walgreens populate. It doesn't matter which location you choose, but choose the Walgreens here. In this case, that's where he goes. And here you go, voila. It's going to tell you now there's a whole list. There's 32 prescription drug plans available for this particular area for what in Maricopa County, and it sorts it automatically by the lowest drug and the premium cost. You want to make sure you're sorting plans by the lowest drug plus the premium cost. Let me tell you why. You'll notice here that the top plan, the most cost-effective plan for your client, happens to be a WellCare product, which we can sell. If you don't have the WellCare contract and you want it, let me know. We can get you that contract. But it's $17.60 with a yearly drug and premium cost. When you add up everything together throughout the year, your client's going to spend roughly $211 for the year for his medications. That's assuming he's going to Walgreens, and it's assuming those 3 medications that we put into the system here. Now, if you were to sort this by lowest monthly premium, right? it's going to come back and tell you, oh, SilverScript, yeah, no brainer. It's only $6.60 a month. But look at the yearly drug and premium cost, $705. So what that tells me is that there is possibly a drug that's not covered by this SilverScript, or it's considered a tier 2, or it could be that the pharmacy, Walgreens in this case, is not in network, right? So this would be a bad decision for your client by just putting them on the lowest monthly plan premium cost with SilverScript, because they're going to eat it throughout the year. It's a bad deal. So make sure you're on lowest drug plus premium cost. Now, what I do then is I always want to show my client the top 2 plans that I can sell. So this one I can sell. So here's the top one. Okay, this next one is actually neck and neck. It's another WellCare product. I would need to check with my local broker manager, but I think this Medicare RX Select is a newer PDP plan over this value script. You'll notice it's only $2 difference. So I don't necessarily need to care about showing him this plan because it's basically the same plan. Here's a Cigna plan. Cigna PDP plans are non-commissionable, so we can't even sell that plan. So the next plan that I can sell is an AARP United Healthcare Walgreens plan. Now, its drug cost is $373 for the year, right? So I'm going to give my customer options. I'm going to compare this WellCare Medicare RX Select plan with the AARP Walgreens plan. So they're in my little box down here. I'm going to hit compare. At this point, I can print this little page out. I can save it as a PDF, whatever you want to do. I'm going to provide it for my client. I'm going to show them. Here's the monthly plan premiums, right, and so forth. But this is the key number down here. What's your annual cost compared to the 2 plans here? All right. So that's the number that you really want to show your client. So that's one comparison that you can give to your client if you want to compare it in writing for them. The other tool that's really nice from here is back on this page here. Let's say you want to give more details about this particular plan. You can hit view drugs and their costs. Okay, and this gives a complete rundown of this particular plan, the WellCare plan, and it shows your client in detail how this plan is going to work, if there's deductibles, how much those deductibles are, if they're going to hit catastrophic coverage, all that stuff. And then it tells you again, here's your estimated annual cost, but what is it going to cost when they go to Walgreens to fill their scripts? And it's going to cost them $0. In this case, these are all tier 1 drugs and so forth. Okay, so that's the WellCare Medicare RX Select plan. You can also come back down here to the AARP plan, hit view drugs and their cost, and again, basically what they're paying more for here is that monthly premium. Okay, for this particular plan. So that's why it's more expensive. They're still tier 1s. Everything looks good here, but because it has a higher monthly premium, that's why they're paying more throughout the year. So now you've given your client a couple of choices, and you're going to be able to help write them on the right plan for them. If you have any questions, give me a call. I'll be able to help you anytime.